Okay, a very good morning to all of my dear viewers. So, in today's session, we are going to discuss a very important topics of forensic medicines, and the name of topic is suffocation. So, let's see. This suffocation is a broad term. So, any form of asphyxia other than hanging, strangulation, and the drownings, they comes under suffocation. So that's why I told to you that it is a very broad terms, because any other form of asphyxia other than strangulation, hangings, and what this drownings, they comes under the suffocation. So there are some different types of suffocation that we are going to discuss one by one. So we start the topic with environmental suffocation. So what is the meaning of this environmental suffocation? The normal oxygen concentration in our environment is 21%. So if the oxygen concentration in our environment is less than 15%, the person feels suffocation. Or if the oxygen concentration in our environment is less than 5%, that leads to be death of person due to the asphyxia. So normal concentration of oxygen in our environments 21%, less than 15% suffocation will occur, and if oxygen concentration is less than 5%, that leads to the death of person due to asphyxia. So this is all about the environmental suffocation. The next type is smothering. So what is this smothering? A smothering is basically the blockage of external openings like the nose or mouth. So how any person can block the external openings like mouth and nostrils? So they basically block by pressing tape over the nose and mouth, pressing pillow over the nose and mouth, or we can say that covering the face with the plastic bags. So these are the common examples of smothering. So what are the post-mortem findings in case of smothering? One of the common post-mortem finding in case of smothering is obviously the cyanosis, petechial hemorrhage, and the congestion of organs. The other findings like the fracture of nasal symptoms, nasal marks due to the struggle, or we can say that there is blood staining froth. So these are the common post-mortem findings of smothering. Now the next things is what are the medical legal importance of smotherings. The medical legal importance of smotherings are it is either homicidal or accidental in case if any person fall into the mud or in sand. So this is all over about the smothering. The next thing is gagging. So what is the gagging? Gagging is basically pushing forceful gag material into the mouth and pharynx. So when any person pushing forceful gag material into the mouth and the pharynx, the main purpose of gagging is to silence the victims. But sometimes what happens, this gag materials, they obstruct the oropharynx if they pushing deep inside the mouth. And another things, it may be if pushing gag material into the mouth along with covering the nostrils, they obstruct the airways. So whenever the airways are completely obstructed, that leads to couch asphyxia, and finally the death of the person will occur. So this is all about the gaggings. Now we move toward the reading section. Suffocation, I already discussed, it is a broad term. It is a form of asphyxia other than hanging, strangulation, and drowning. The types of suffocation are the environmental suffocation occur when oxygen levels in the environment is less than 15%, and if the oxygen concentration is less than 5%, the person will be die due to asphyxia. Okay, so what are the conditions in which the environmental suffocation will occur? It will occur in case of closed space, high altitude, deep sea, because in all these three conditions like closed space, high altitude, deep sea, the oxygen level will be less than 21%. I mean, and for the suffocation, obviously, it will less than 5%, 15%. The second types of suffocation is the smoothing. What is the smoothing? It is due to the occlusion of external openings. External openings like nostrils and mouth. So how this external occlusion will occur? It is due to adhesive tapes over the mouth, hand placed over the mouth like that, pillow pressed over the mouth, and the plastic bag covering the face or head, we can say that. The post-mortem finding in case of smoothing are congestion, cyanosis, and the petechial hemorrhage. Pallor around the mouth and nose. This is one important findings. There is paleness around the mouth and nose. So if during the post-mortem examination you observe the paleness around the mouth and nose, we can suspect it is a smoothing. Blood stained froth, nail mark due to the struggle, flattening of nose, nasal bone fracture, bruise, laceration. This is all due to the struggle during smoothings. Medical legal importance: homicidal smoothings, accidental when any person fall in sand and mud. So this is all about the smoothing. The next thing is gagging. So it is due to forcefully pushing any gag material into the mouth and pharynx. So if anyone forcefully pushing the gag material into the mouth and pharynx, the condition we call it as a gaggings. The common gag material are the clothes and paper. So normally what happens, the criminals or any person, they want to silence the victims, then they push any clothes or paper ball into the mouth to silence the victims. Okay, the main purpose of gagging is obviously silence the victims, but sometimes what happens when the pharynx is obstructed, when the gag materials pushing deep into the mouth, and another things, if the gag materials are present in mouth along with closing the nostril, so in this condition also we block both the airways. So if the both the airways get blocks, the person will die due to the asphyxia. Okay, post-mortem finding: congested face, cyanosis, petechial hemorrhage, and organ congestion. And commonly it is done in case of homicidals, rape, and robberies. So this is all about the, here we discuss only the three types. Some more types of suffocation we discuss in next